Hi, welcome to this session. In this, we're going to cover the topic of cardiac catheterization and we'll learn how the cardiac catheterization works. What is cardiac catheterization? The, this cardiac catheterization, also referred as the cardiac cath or heart catheterization or coronary angiogram, is a medical procedure that allows your doctor to see how well your blood vessels supply to the heart. Now that we have the basic definition, let's understand what is the need or in what scenarios the cardiac catheterization is done. So this procedure is decided by your doctor, for example, to handle, check for the heart disease such as the coronary artery disease, the heart valve disease, or the diseases related to the aorta, or to check how your heart muscle is working and decide whether you need further treatment such as the interventional procedure or the bypass surgery. Often in this procedure is used to diagnose and treat certain cardiovascular conditions, and in this process a long thin tube called the catheter is inserted into the artery or the veins in your groin, neck or arm and then threaded through the blood vessel to the heart, and the visuals show this aspect. The catheterization shows the retrograde filling of the dye to the pulmonary artery from the dilated circumflex coronary artery through to the pulmonary fistula in the aortic angiogram. So what does the procedure or the process entail? One, the doctor uh, basically determines the number where the catheter will enter the blood vessel. Two, a needle is used to make a small hole in the blood vessel into which the tapered tube called the sheath is placed. Then the doctor puts a thin flexible wire through the sheath and into the blood vessel. The doctor threads this guide wire through the blood vessels up to the heart. The wire helps the doctor position the catheter correctly. The doctor then inputs a catheter through the sheath and slides it over the guide wire and up to and into the heart. The doctor moves through the catheter into the right or left artery or into the heart chambers. Once the catheter is in the correct spot, the guide wire is removed. Using the catheter, the doctor can now test or treat the problems. And now he puts into a special contrast dye into the catheter. This dye makes the inside of the coronary artery or the heart structures look up in a X-ray image, and this process is generally defined as the coronary angiography or the coronary arteriography. After the test or the procedure, the doctor pulls back the catheter and removes uh, it and the sheath as well. What is contrast media? As we have seen, the contrast dye is put through. This is essentially a contrast media that is used for conducting this medical X-ray type of technique so as to picturize the entire veins and the angiogram taken. So this could be used in tandem with the MRI or the computed tomography, CT, angiography, and occasionally even the ultrasound imaging. So the contrast media enhances and improves the quality of the images so that the radiologist, that's the specialist doctor trained to examine the images and provide a written report to the patient's own doctor or specialist, can now more accurately report on how the individual's body is working and whether there is any disease or abnormality present. The radiologist carrying out the procedure is responsible for deciding if the contrast medium is needed and which contrast medium will be put through for the best imaging. For example, iodine. So this is basically a contrast medium that's or latex, gadolinium in case of the contrast medium related to some of the contrast dyes. So though not for the heart, even for the kidney conditions also this type of contrast dyes are used. So this gives you a perspective of what contrast dyes are and their critical role in producing some top class imaging so as to identify the issues and to easily conduct the procedures. As you can see here in the picture, so this is one of the as the wires are being inserted through this small hole. So this is a delicate procedure that the specialist would do. So this gives you a perspective of what is cardiac catheterization and what is involved, and this gives you the perspective. Thank you very much for your attention, and for any further details to contact you can get to the website and download the additional information. Thank you once again. See you again. Thank you.